Good morning. I'm here to talk to you about a program I've created called Living Together, a new program to grow community within long-term care. This is a program to combat social isolation. Social isolation is a huge problem among the elderly in long-term care today. I want to propose to you a solution. It would exist in long-term care facilities and be coordinated by a dedicated social worker. It would involve all levels of staff within the community, from CNAs to RNs and to administrators. The purpose is to create a sense of community and instill a sense of purpose within residents and family members to combat social isolation. Assessment would be used by the RN to target at-risk residents. Long-term goal is to change the perception of long-term care among the community as a negative environment and one that residents are happy to be in. Social isolation is a significant problem among residents of long-term care facilities. The reason for this are RNs and CNAs are overworked. They don't have time to interact with patients. Typically, long-term care facilities can be depressing environments. Families are not able to visit or simply do not, and there's not enough group activities structured due to lack of time and resources. Let's talk about the history of long-term care for a minute. Today's long-term care facility evolved from the workhouse model brought over from England during the early 1920s. With the rise of the Industrial Revolution, families were working more and more away from the home. It became less and less convenient for families to take care of their elderly. The workhouse model applied more to homeless and transients. Workers could receive room and board for performing small and menial jobs. Rooms were also available to the elderly who could not be cared for at home, and if they were not able to work, they would be exempt from having to work. You can imagine the condition of these workhouses. They were heavily underfinanced. Since government intervention and its healthcare has privatized and products like long-term care insurance have evolved, conditions have greatly improved. One major problem remains is that residents of long-term care facilities are at a large risk, still at a large risk for social isolation. So the purpose of this project is to target residents at risk for social isolation through nursing assessment, to engage them in meaningful activity and community, to encourage and facilitate a sense of community for the entire facility through group activities and family participation, to set goals and measure success for the individual using the nursing process. Let's talk about some actual goals of the program. We want to reduce the occurrence of social isolation and be able to measure its success. A big part of this is going to be emphasis on activities of daily living, ADLs. Um, these people have lived their lives, they've taken care of themselves, their families. A big part of a big component of social isolation is losing your self-worth, and losing control over your environment equals loss of self-worth. So we want to train our CNAs, who are typically helping our residents with their ADLs. We want to teach them how to assist them in a way where our residents feel like they have control over their environment, or at least a substantial amount of control. We also want to increase family visits. For families that can't do it frequently, we want to make this more convenient by using webcams. We want to typically families, it's reasonable that families could take a half hour of their time to sit at home and be on their computer and spend time with their residents. Or their loved ones, excuse me. We want to organize more group activities within the facility. Wii bowling is a great option, highly interactive, highly engaging. You don't need a lot of motor skills. A lot of our residents are limited by range of motion, pain, arthritis. Wii bowling makes a really fun activity that doesn't require a lot of motor ability. Community garden is another thing. This is an indoor community garden. It's something that the residents can engage in over a period of time. They can see the plants that they planted and watch them grow over time. Gives them something to look forward to in the next day. Another goal of living together. We want to thriving socially in long-term care in a long-term care facility should now be a standard of care. So we want to target the residents that are at risk through assessment using our screening tools. We want to set individual monthly goals for residents that include we're going to include them in the plan of care. And then we want to evaluate our residents on a monthly basis, change the goals if we need to. And the third goal, this is more of a long-term goal, we want to take the community's view of long-term care, which is generally a negative one, and we want to make it more of a positive one. How are we going to do this? We're going to take a baseline survey amongst the community and kind of see, what they think. And then we want to market living together, which is a positive way to view long-term care and a positive thing within long-term care. We're going to market it in the facility, to the patients, to the family members, and then within the community. And over time, as the program takes hold and our residents are living happier lives, we want to reevaluate the community's opinion of long-term care. We're going to do this once a year, and the families that participate within the facility, we want to take their opinion every 6 months. Some benefits of this program. To the staff, it's going to make the facility a much better place to work. Going to be a much more pleasant environment. We want to make this a positive environment. It's going to make interacting with families a much better experience. As the reputation of the facility improves, staff's going to have much more pride in their job. They're going to be happy to tell people that they work at a long-term care facility. As the facility becomes more attractive, demand on the rooms will go up and prices will go up, and the pay to staff will increase. Those are great things. So some benefits to the residents. This is going to be a better place to live in. You're going to be happy to call this place the place where you live. And then some benefits to the community. We want to improve community outlook on long-term care. The community will view long-term care as a desirable option for caring for their loved one. Let's talk about how we're going to implement this. Our expected launch date, February 2nd of 2015. Training of RNs, CNAs, and OTs is going to begin October 1st. We're going to have some additional needs. This is going to be, first we need to designate a social worker. This is going to require some additional salary on their part. We need to create and print our screening tools. We're going to need some equipment as well. This is the electronic equipment listed, mainly the Nintendo Wii, the Apple iMac for the web conferencing, and materials for building the indoor garden. Let's talk about some potential barriers. Finance will be a challenge. We need an additional $17,000 in the budget for the first year to complete this program. We're currently looking at some options for federal grants and also private donations. Some more barriers. The staff may be resistant to change. They've been doing things this way and they don't necessarily see them as a bad thing, and it's not necessarily a bad way they've been doing things. We just want to look to the future of long-term care and make a change. Residents are going to be difficult to work with at times. When people live together in community, they don't always get along. This is something we want to train our staff to expect because it's normal behavior, and we want to train them to manage it in a healthy way. And also troubleshooting of the computer equipment. This can be solved just by good training on the front end. And also there is some Apple Care is available for the computer for a small fee, a couple $100, gets you 3 years of coverage and also telephone troubleshooting support. Here's a timeline of the implementation of Living Together. These are extra budget needs. And in conclusion, I just want to say thank you for listening. I really believe that this is the future of long-term care. We want what we're aiming to is overall make this a more positive environment. We want our family members to, or excuse me, our residents to be proud to call this place home. Um, we want to improve their lives, have them thrive socially, as well as from a health perspective. We want the families to be happy that they are leaving their loved ones in our care, and we want the community around us to know that we have a high standard of care, and that when their time comes, or when their loved one's time comes, that this is going to be the place to go. um, so like I said, I really believe this is the future of long-term care. We've taken care of we have the medical part down, but now we have some real work to do as far as the social aspect. So thank you very much for your time, and I look forward to changing the future with you. Thank you.